Hello, everyone. Welcome to today's webinar. We're here to discuss the New York Proposed Cybersecurity Regulation and give you an overview. I know we have several New York hospitals on the call today, including some of those from the Iroquois Hospital Association. So welcome, everyone. And we also have some hospitals attending that are outside of New York that are here to listen and hear what could possibly be coming for your state. So welcome to you as well. I'm Laura Pursley. I'm the Marketing Director for CloudWave. And joining us on the call today, we have Jonathan Bice, the Senior Security Solutions Architect with CloudWave, Tim Quigley, the Chief Client Officer with CloudWave, and also joining us from the Greater New York Hospital Association, we have Pooja Kari. She's the VP of Legal, Regulatory, and Professional Affairs. So thank you for joining us, Pooja. Today, we're going to go through some of the key areas of the proposed regulation. We are going to start by talking about a couple definitions and how those differ from HIPAA to call those out. The majority of today's discussion will be around the key topics from the regulation and give you some tips about how to operationalize those key areas. And then we'll briefly touch on some solutions and services that you can use to meet those regulations. And then at the very end, we have a list of additional resources that might be helpful for you. And then feel free to enter any questions into the questions pane, and we'll get to those at the end of the session today. We do want to start by giving a quick disclaimer that the information that we're sharing today is meant to be a general overview, and this is our interpretation of the proposed regulation as it stands today. It's not meant to be legal advice. We do encourage you to validate this information for yourselves, determine for your own situation what action might be appropriate for you. And we do have some details in this presentation that are paraphrased from the regulations for discussion purposes. We encourage you to refer to the actual document and regulation to see all of the inclusive details. I do want to start by launching a poll just to get an idea of where everyone is in relation to reviewing the regulation. So if you want to take a minute to answer the question and let us know if you've evaluated the proposed regulation and already have a plan for meeting the requirements, or if you've reviewed it in some detail, if you've had a minimal review of the regulation, or maybe you haven't reviewed it at all yet, or possibly you're from another state and you're just here for information. So I'll keep that poll open for another few seconds here. Go ahead and make your selection. And it looks like the answers have slowed down, so I'm going to go ahead and close the poll here. And it looks like the majority, there's a tie between have reviewed it in some detail and minimal review. So that's pretty much what we expected at this point in the game. So that gives us an idea of how to go forward today. So thank you for answering the poll. Just a quick note on the timing. So the regulation was submitted to the New York Public Register on December 6th, and it is currently in the 60-day comment period. And once it's approved, the hospital will have 1 year to comply. And I think, Pooja, did you want to add any comments to kind of the process for how this has been going?
Yeah, sure. Just in terms of reiterating what you said, the regulations are in proposed form, which just means that they aren't active regulations now. They're what the Department of Health would like to do, and they're opened up for everybody to comment. The comment period closes in early February, and as Greater New York, we will be submitting a comment letter on behalf of the hospitals and our membership.
Okay, thank you. Okay, so now I'm going to turn it over to Jonathan to walk through some of the key topics and areas of the proposed regulations and to give some tips of how to operationalize for those areas.
All right, thank you, Laura. We're going to take a look at some of the key topics in the regulation. There are other topics, but these are things we pulled out as being key. And One of the topics is you're going to have to establish, hospitals are going to have to establish a cybersecurity policy and program. Another we're going to look at is the cybersecurity personnel and security policies for third-party service providers. We're going to look at network monitoring and testing, also policy and program development, employee training and remediation, incident response, and appropriate reporting protocols and record retention. One of the key differences in this regulation and HIPAA is the definition of non-public information. And I know this is a topic that Pooja, your group, has spent a lot of time looking into and evaluating, and is one of your primary concerns with this regulation. Can you tell us a little bit about your work and what you guys?
Sure. I will just note that this is definitely the area that we are focused a lot on. Almost the entire proposed regulatory package applies to the term non-public information and information systems. And that definition of non-public information is essentially defined to mean three things. It means a hospital's business-related information. It means private information or PII, and it also means PHI. So as I'm sure most of you know, the latter two, PHI and PII, are what have generally been protected under HIPAA and state law. But this third category, a hospital's business-related information, is what's new. And so that's what we've been doing some work on, understanding with our members what that would entail. And most of our advocacy will be centered around narrowing this definition.
Yes, and this hospital. So hospitals are going to have to determine what systems this is going to apply to. It's going to take considerable resources to figure out what those systems are. So when we look at the cybersecurity policy and program, hospitals are going to have to establish their policies and procedures for the cybersecurity program based on the risk assessment. And this regulation is designed to supplement HIPAA, not replace it. You're going to have to identify and assess internal and external cybersecurity risks that may threaten the security or the integrity of non-public information. And you're going to see that definition of non-public information throughout the regulation. You're going to have to use defensive infrastructure and implementation of policies and procedures when it comes to your information systems and non-public information. The regulation has a list of requirements. One of those requirements is a CISO is going to have to be designated, and that can be an individual from senior or executive staff that can serve as a CISO. Some things your organization can do to prepare is to review your current policies and procedures and compare what you have now to what the regulation specifies you're going to need to be doing. You're going to have to determine if your risk assessment process meets what the regulation requires. And you can potentially outsource to a vendor that can help you evaluate the New York regulation criteria. You want to consider a maturity model that'll help you identify the gaps between current state and future state. Looking at cybersecurity personnel and cybersecurity policies for third-party service providers, hospitals are going to have to use qualified cybersecurity personnel to be able to manage the hospital's cybersecurity risks and evaluate the performance of the cybersecurity functions. Each hospital is going to have to utilize an affiliate or a third-party service provider, or you can use a third-party service provider to comply with the requirements in this section. Hospitals are going to have to implement written policy that's going to be designed to ensure that those third-party providers protect that non-public information that they have at their access. You're also going to have to implement risk-based authorization or multi-factor authentication for protection against unauthorized access for anyone entering the internal system from an external environment. Some things you can do to prepare is to determine if you have in-house resources to execute. And if you don't, look for some third-party providers that can help you here. Network monitoring and testing. The cybersecurity program for each hospital is going to have to monitor and test in accordance with a risk assessment to assess the effectiveness of the hospital cybersecurity program. And you're going to have to assess changes in information systems that could create vulnerabilities. The monitoring and testing is going to have at a minimum a penetration test of the information systems by qualified internal externals at least annually. Automated scans or manual scans, this is vulnerability scanning. Reviews of information systems are going to need to be reasonably designed to identify publicly known cybersecurity vulnerabilities. And you're going to have audit trails and records maintenance. Some things you can do to prepare here is you want to do your pen testing, your tabletop simulations early. A lot of times those get scheduled later in the year, and doing that earlier on is going to help you identify where you need to be focusing. You may want to focus your budget here and outsource these activities to experts that's going to be able to help you and provide some concise direction. When it comes to employee training and remediation, you're going to need to implement risk-based policies, procedures, and controls to monitor the activity of the users and detect any unauthorized use, tampering, and any kind of misuse of non-public information as well as that HIPAA information. But the regulation also specifies providing regular cybersecurity awareness training for all personnel to reflect risk identified by the hospital in the risk assessment. And that may include phishing exercises, but it's also, this is a little bit different in saying that things identified in the risk assessment need to be a part of the cybersecurity awareness training. Some things you can do to prepare is, in addition to training, take advantage of free cybersecurity training opportunities and resources that are going to focus on current threats and new ways to approach cybersecurity. Incident response. There are several criteria for the incident response plan outlined in the regulation. These are a few of them here. I'll refer you back to the regulation for all of those. But you're going to want to make sure that your hospital establishes a written incident response plan that contains all of these elements. One of the things you can do to improve your incident response plan, you want to make sure you have tabletop simulations that are going to test the entire incident response plan. Make sure it goes beyond IT, and then update it accordingly and continually test and improve the incident response plan. Reporting protocols and record retention. The hospital CISO is going to have to notify the department within 2 hours of a cybersecurity incident. This 2-hour time frame is much shorter than what the SEC has in their reporting requirement. That's a 4-day requirement. So this 2-day requirement is really short. Could you give us a little, from your perspective, about this 2 hours and what your group thinks about this?
Yeah, I mean, I'm not particularly sure that it's tied to anything of substance, but I can tell you that this is a big issue for our members, as I'm sure everybody on this call attending knows that, you know, the first couple hours, if not first day within a cybersecurity event, is chaos, and there's a lot that's being done on the scene and trying to work through and trying to figure out. So this is definitely one of the areas that we'll be pushing back with DOH. You know, one thing for this group that I would be interested in knowing, maybe offline or if there's time at the end, is that One of the reasons DOH has conveyed to us that they want to be notified of an incident is because some of their systems connect to some of our hospital systems, and they need to know for technical purposes. And I can't quite wrap my head around that. I don't know how accurate that is, or whether there's other measures in place that would get them the notification they need. But that's something that DOH is concerned about as well as the effect on patient care.
Thank you.
Yeah, that is interesting. Sorry, Tim Quigley, Jonathan, sorry for interrupting you, but that is an interesting point. You know, as a hoster of EHRs, we see that pretty regularly, where you have virus activity propagating from a client site up towards our data center. But you know, that's something that we monitor and stop on our own. We don't need the client to notify us. I'm hoping they'll change that, because unfortunately, as a lot of people on the call, having been in the middle of that, when you're an hour two, notifying the state government is sort of the last thing on your mind.
Yes, I agree.
Do you think they're likely to change that, or is that?
I can't speak for them. I'm not sure. We're definitely advocating for a change, but I don't know how likely it is.
Okay. Sorry for interrupting.
One thing to note is, even though after this regulation, if it were to be approved and go into effect, and you have a 1 year to respond, the reporting requirement is going to be effective immediately. And then the records are going to need to be maintained for a period of 6 years. One of the things that organizations can do to prepare is to make sure the incident response plan has clear roles and responsibilities for reporting, and to test that reporting when you test or do your tabletop, and test that reporting to make sure that you're going to be able to meet that 2-hour requirement. Funding and costs. $650 million funding has been announced by the state. Some of that is going to be applicable and be able to be used. It's going to be available to hospitals and other facilities. One of 4 areas that can be applied for is going to be cybersecurity. Another area is going to be spending on EHRs. That's believed to be where a bulk of the money is going to be allocated. And the funding is really going to apply to capital purchases rather than operational. The state of New York has done some estimates on the expected cost of meeting the regulation. It's really going to depend on the cybersecurity maturity of the organization. You can see the numbers there of their estimates of what the costs to meet the regulation are going to be. Some summary tips to operationalize and meet the requirements is, you're going to want to do an assessment and look at the current state, and then compare that with what the regulation is requiring, and look at the gaps between current state and future state. Another thing to do is to identify areas where you may need to implement compensating controls. So if it's infeasible or impossible to implement a control to meet the regulation, then you're going to have to implement a compensating control and document accordingly. And that documentation requires the CISO to document and state why a compensating control has been used. Another area is doing the pen test and tabletop simulations early in the year to make sure that you're able to align with the regulations in HIPAA. And doing those early in the year are going to help you shape the direction of where you want to go and make sure you can get to your future state. Once you identify the gaps between current state and future state, you're going to have to lay out a plan to meet the regulation within that 1 year time frame. In areas where it's going to be difficult to do that, organizations can partner with a healthcare specific cybersecurity provider to help fast track and meet the requirements. Things to watch out for as it's currently proposed. What's going to set apart organizations that are able to meet the regulation from those that aren't could be the level of board support or executive support they get. It's going to be difficult to meet the regulation and to get everything done without board level support. Depending on the cybersecurity maturity, this could take a lot of resources to implement. It could be difficult to get it done within that 1-year time frame. Organizations are going to have to spread resources across different information systems, whether it's implementing MFA, non-public information systems, identifying what that non-public information is and where it's at. As Pooja said, it's going to be a core piece of being able to get this done, is identifying where that information is and how to implement controls to meet the regulation. It's going to be important to start planning as soon as possible. And even though this is in a proposed form, it probably wouldn't be a bad idea to go ahead and start looking at the current state and how it meets the regulation to be able to develop that plan to meet the 1-year timeline. Again, the funding is only for, well, a portion, most of it is only going to be for capital. There will be some opportunity for operational, but the majority is going to go to capital. Right now, the penalties for not meeting the regulation are not clear. Organizations are going to have to pay attention when those penalties come out so they can be considered in the risk assessment. The proposed requirement is, we talked about the 2-hour requirement and that being difficult. And then the maintaining records for 6 years is going to be a new requirement. Not only are organizations going to have to maintain those records, but a process for maintaining those records, securing them, and the amount of storage it's going to take to do that have to be considered. Now, Pooja, can you tell us a little bit about the Greater New York advocacy and the work you guys are doing?
Sure, yes, thank you. So, as many of you know, we represent the hospitals in New York State, mainly downstate, but a couple upstate. And as part of our advocacy, we have hosted the Department of Health for 2 meetings. The first meeting was with representatives from HHS, and some of you may know that are, on all of the listservs about cybersecurity and follow the news around cybersecurity. HHS is doing a lot of work on this issue as well, and it is expected, I think it was supposed to come out today, I don't know if they've released it yet, but they are working on voluntary standards for hospitals to meet in regards to cybersecurity, and they are going to be developing incentives to get hospitals to adhere to those standards before they move to penalties for non-compliance. And HHS is also considering amendments to the HIPAA security rule. So one of the big asks that we are putting forward to the state is that they should wait for HHS to complete its work and see where they land so that we don't have, 2 conflicting or potentially not aligned regulatory standards out there. And then the other big advocacy point we're making with them is that if you take a look at the proposed regulations, they've done a lot of what I call cutting and pasting of regulations from HIPAA and putting them into this package. One of the requests we have of DOH is that instead of using the language exactly, what we'd like them to do is to instead defer to certain standards and to, also defer not just to the HIPAA security rule, but to certain NIST standards, to some of the guidance documents that the, private-public federal partnership has come up with, like the HICCUP. Those are the standards that, we would see as, quote, industry standards, and we'd rather that they defer to those already created, already vetted, already peer-reviewed documents, rather than trying to come up with their own solutions. And, you know, as a sort of third alternative, if they do want to finalize something substantive, we are asking them to narrow some of the definitions and to really consider what the impact of applying a lot of these provisions to non-public information would be. So comments are due in early February. We also hosted a number of our members with DOH about a week ago to provide some feedback directly to DOH, and DOH had some good questions, so it was a robust discussion. We're hoping that they took some of what our members had to say. We're hoping that they implement some changes, and you know, we'll definitely keep Sensato and CloudWave updated on where we land.
Thank you.
Okay, great. Thank you, Pooja. We appreciate you joining us and sharing your perspective and your advocacy.
All right. Now Laura's going to talk about some of the solutions and services that CloudWave has that can help you meet these regulations.
Thanks, Jonathan. So we understand that everyone on the call is probably in a different phase of maturity or implementation, and hopefully you've already been doing a lot of the things that are in the regulation, so it won't be as big of a lift for you. But if you find yourself in a position where you haven't been doing some of those things and all of the regulations seem daunting, just wanted to share with you, if you're not aware of the services that we offer, we have a lot of services around, we do tabletop simulations, pen testing, incident response services. We offer a virtual CISO program. So we are here to help you. If you have questions, if you want to talk about some of those services in more detail, we encourage you to reach out. We're happy to talk and see where we can help in those areas. We also offer a cybersecurity as a service program. This is a managed cybersecurity service, and this is meant to take the burden off of your IT team. We take on all of the compliance, detection and response, and it's backed by a 24/7 cybersecurity tactical operations center that is healthcare specific. So we understand the healthcare market, and it's a tactical operations center that understands the unique needs of the healthcare space. And included in that is strategy, guidance, and compliance as well. So we'd be happy to talk to you about that if you have a need for those types of solutions and services as well. And I just want to talk for a moment about how we approach risk assessments and cybersecurity maturity. We can do your typical risk assessment, but the way that we approach it is to really do a cybersecurity capability maturity model. We call it C2M2 because that's a mouthful to say all those words. So C2M2, and what it does is it evaluates 10 different domains, and it really helps you narrow down and focus those gaps between where you are today and where you want to be, specific to HIPAA, NIST, and now these New York regulations. So it's a really great way to convey to your board, to your C-suite, where you need to focus your energy, your resources, and your budget. So happy to talk to you about that in more detail as well. And in this presentation, we've supplied a list of resources here for you to take advantage of, to read more about the proposed regulations and to get help. There's a lot of New York State specific links in here for this regulation, but then also some links to CISA and HHS that Pooja was referencing. And we have some specific educational cybersecurity resources for you. We run an insider program. If you're not part of that, we encourage you to sign up for that. It's a free program, and we offer education, one live webinar every month, and other valuable tools with threat intelligence and things like that. So feel free to check that out. And we also have an educational toolkit specific for healthcare that has a lot of links and resources available to you. So if you'd like a copy of this presentation, you can reach out to us to get these links. And for more information, if you're in New York, you can contact Paul Denver. His contact information is here. He manages the hospitals in your state, and he'll be happy to go through any of the information today, talk about any of those resources or any of those solutions. If you're outside of New York and you'd like some of that same information, you can reach out to us at customersfirst@gocloudwave.com. And if you do have any questions, please enter them in the questions pane and we will get to those. We do have one now. I'll read this out and see who wants to chime in on this one. It says, curious your thoughts on the possibility of regulations like this being proposed in other states.
I'll take a first stab at that. Pooja can correct me if I'm wrong, but one of the reasons why we did this sort of as an open invitation and part of the whole cybersecurity program for us was because New York has a long history of being a leader in both the advancement in healthcare IT policy. So I think back, it was probably 10 years ago now, that they were, I think, the first state to require multi-factor authentication for the prescription of opioids and other medications. I'm bungling the language of it, but you know, we at CloudWave look at New York as sort of being on the leading edge of that, and we assume that it may not follow in all 50 states, but it will follow in a significant number over kind of the next 10 years. So electronic prescribing of controlled substances. I knew if I kept talking long enough, it would come to me. So that's why we opened it up to sort of everyone instead of just, you know, ring fencing it to our New York customers. Pooja, do you have any thoughts on that?
I don't think so. I think you've summarized it well. I know the press around this regulatory package was very much of the tone as there's no other state that has this, and New York is going to be the first. If you take a look at some of the regulatory analysis language, there's some interesting statements in there about PHI and PII not being protected by any law, which is sort of a curious thing to say given HIPAA and given the general business law. But I think there's definitely a sense of trying to be the first and trying to do something different.
Okay,
I think when you look at privacy laws, the United States is really lagging behind several other countries. And when I agree with Tim that we're going to see more of this. And when you look at what the SEC has done with their regulations, yes, New York is proposing the first, but I do believe you're going to see more of this, and I do think you're going to see more privacy regulations in the United States to bring us up to where you may be familiar with GDPR over in the European Union, or even Canada has privacy laws. So I think you're going to see more of this, especially in healthcare. And it's going to be a trend that we're going to see for the next definitely months, if not years.
Okay, thank you. There was another question that came in. Can you clarify keeping data for 6 years? Is this regarding reports and information in regards to breaches? So in other words, is it all records for 6 years or only information that's relative to the breach?
When I read the regulation, what I got from it is anything to do with the security program, security policies for third parties, and any incident and documentation for that incident as well. Pooja, do you have any more to add to that?
No, that's how I read it as well, and it is an incredibly burdensome requirement. We've had a couple of our members give us cost estimates as to what that would entail for them, because they currently are not maintaining records to that degree. They're maintaining what they need for record retention purposes that are already delineated in law, as well as litigation purposes. But yeah, there's not a retention that's happening at the level that's proposed in this regulatory package. It is an extensive requirement.
Yeah, and it's interesting because you know the 2-hour requirement is a little onerous, but the cost of compliance is relatively minimal. The cost of compliance here is much more substantial. Although you know, healthcare organizations are used to keeping data for a long time. I mean, almost every state we deal with, especially with pediatric patients, it can be, you know, age of consent +7. So you're looking at, you know, often 20+ years for holding that data. But it does certainly have a significant cost component to it. Is that the biggest pain point your clients are pushing back on, or is there something else?
That's for me.
Yep, sorry.
I think the biggest pain point is starting with the definition of non-public information, because so many of the requirements stem from that definition. If we're talking about the actual regulations as written, I think probably the bigger issue is the fact that HHS is doing work on this as well, and it doesn't make sense for the state to move forward if there's so much federal activity happening. So that's sort of the bigger pain point, is let's not have two separate things going on. Let's try to align and defer as much as possible. And then in the alternative, we need to narrow these definitions to make them something workable.
That's interesting. Thank you. And the MFA requirement, most of the folks are kind of on board with that already, or?
Well, again, this is sort of tied to non-public information. So
Yeah.
Many organizations have done the assessment of MFA and acknowledged that it is the best practice and it is what they would like to do, but given the cost, you know, it's implemented where the risk is the most. And if you take a look at the way in which the requirement is written, it's tied to non-public information, access from external to internal. It's not tied to the same things that hospitals are currently looking at. So it's definitely a point that we're pushing back from the perspective of what should this apply to. We're not saying that it's not a best practice. We're not saying that we don't all want to get there, but if we're going to have to allocate resources, it's an expensive resource to allocate. The RFA money that was explained doesn't cover something like MFA. Then we need to be reasonable about where you want it to be applied.
That's a great point. So even, you know, I think of a lot of customers we deal with, they have MFA into the hospital network and then therefore into the EHR through the hospital network, but they allow their employees to access, you know, Microsoft directly for Outlook 365. But it sounds to me like you would have to put an MFA barrier in front of Outlook even there, wouldn't you? Possibly. I mean, it's always a little subjective at this point.
Yeah, I haven't done the particular analysis on Outlook, but it's possible if it fit into that definition of non-public information. You know, I would say that it does seem like there's a compensating control sort of alternative, but it may not be quite aligned with how we think of compensating control under HIPAA. So again, I think if we can just get it narrowed down to what's important, you know, PHI, PAI, then it makes it more workable.
Tim, I believe the multi-factor authentication is really going to be focused on accessing internal networks from external. Now, in your case of Office 365, that could be considered external to internal depending on how they look at it. But for most cases, once you get from external to internal, maybe through VPN, from what I read from the regulation, you should not have to implement a zero trust. I don't think this is a zero trust regulation to where accessing internal resources once you're inside are going to have to be MFA controlled, as much as it is very similar to what HIPAA has for external to internal now. The difference is going to be any system that is non-public information is now going to have to be included. So that could be your payroll systems, your HR systems, all of those are going to be added into that scope. And when we look at the documentation retention requirements, there also is a section inside of the regulation that says that not only do you have to record and have that information for 6 years for particular information, you're also going to have to remove, destroy, or get rid of information that is no longer used as non-public information. So Pooja, have you covered that any, or have y'all talked about that aspect of removing non-public information? Because
Yeah, again,
typically hospitals.
Yep. Again, it's tied to that. It's all tied to that fact that it's tied to non-public information, right? I think most hospitals and health systems already have processes and procedures in place as it relates to sensitive information, meaning PHI, PII. There's already certain disposal policy and procedures in place. And so expanding that requirement to non-public information would definitely be burdensome and costly, but it's an issue we brought up. And that we're going to be addressing in our comment letter.
That's great. Thank you. Laura, any other questions?
We don't have any other questions at this time. So thank you everyone for joining and for the great discussion. And thank you, Pooja, for joining us and sharing the advocacy that your team has been working on. And we'll likely be sharing information once the regulation is finalized or not later in February. So thank you, everyone. And we will be sending out the recording to this session. And as you exit the webinar, there is a short survey. We would appreciate you taking the survey and giving us some feedback if you would, please. Please reach out with any questions. Thank you.
Thanks, everyone.